What's it like living with a TBI or traumatic brain injury? I'm Kat. Welcome to my channel, Living Solo, Living Well. And I wanted to talk about living with the symptoms of a TBI, a traumatic brain injury. I had a pretty bad fall a little over 4 years ago and sustained a brain injury as well as issues with my spine, a fracture, and some other things. And I did a lot of research afterwards because I wanted to know if everything that I was going through and symptoms that I had and still have were related to the brain injury, because it kind of was hard to do a lot of things, and it was stuff I didn't really know about. Even as a nurse, I didn't deal with traumatic brain injuries or patients with head injuries. So I thought today I would just go over a list of, these are the symptoms that I have, that I experienced initially. I have all of these currently, but they are not all as severe as they were initially. So I just wanted to possibly help somebody out there that might be going through something like this. You know, I did a ton of research, and I had to educate myself on all the things that were going on because this was a work injury and I was getting no help from workers' comp. So, you know, all my symptoms were being ignored or downplayed or poo-pooed. You know, I was told at one point by a physiatrist that these symptoms like these usually heal after, 2 or 3 months, and it's been 6 months for you. And I said, I'm doing what everybody tells me to do. I mean, I was so frustrated with him. Thankfully, he didn't want to see me anymore because he knew that I didn't trust him. I had a neuropsych eval, and I expressed during that interview with the neuropsychologist that I didn't care for the guy. I didn't trust him. And so, of course, he relays that to him in a report. And thankfully, I was discharged from his care, so didn't have to deal with him again. Workers' comp does not look too highly on you not wanting to see a doctor. Like if it was my choice and I said, no, I don't want to go see him anymore, I don't like him, they don't like that. They think that you are not wanting care for your symptoms. So thankfully he initiated it and I didn't have to see him. But he was an hour and a half away, so I did not choose him initially. It's a long story, and I won't get into that today. But anyway, he's gone. He was done. Yay. So anyway, I wanted to just kind of give you a peek into my world, what it's like living with a TBI. And these are daily, pretty much daily things. And everything that I relay to you is not a complete list. There are things I'm sure I haven't really thought about, or, rack my damaged brain to try to figure out all the different symptoms. But and these are in no particular order. So, and some of these I've touched on in prior videos. So number one, not in any order, are vision difficulties. So those vision difficulties are double vision, depth perception. I have a hard time with that. I struggle with that. I lost my vision in December of 2023. That was fleeting, but it was, I don't know. I couldn't see a clock because I couldn't see. But I was on my computer one morning. My sister was in a back bedroom when she was visiting for a while. And all of a sudden I had intense pressure, like around and behind my eyes. And then I lost my vision. So I am guessing that it might have been 20 seconds. I don't know. But everything went completely dark, like a dark gray. And then I'm just trying to process it. And then it came back. So I don't know what happened. I did talk to the vision specialist when I started seeing him last September. And he said it could have been compression on a nerve. They don't know. So some kind of spasm maybe that caused pressure on a nerve. So I don't know what caused it, but I also have, these are prism glasses. I did a video early on when I started doing videos for YouTube on my prism glasses. So anyway, so these help my eyes. They are trifocals, and they have prism in them. The prisms, I believe, are along the outer portion of the lenses. So other vision issues that I have, this right eye kind of turns in a little bit, and this eye doesn't. But when I track, or what's it called? I can't remember the phrase, but what they say, but when I'm reading left to right, I have a very difficult time because my eyes want to jump back because it's like I'm not picking up what I'm reading. So I can't read books. It takes a while to read stuff. And, that's difficult. That it's a struggle because I used to love to read an actual book. I liked reading novels and can't do that. So have a hard time with that. And I also, when I lean back, like in my recliner, and I found this out one time when I had turned my head to look at my cat, who was over in the distance, and I started getting nystagmus. Now I would have that when I would lay down, either on the floor to stretch or on my bed when I went to bed, and the nystagmus, my eyes will twitch back and forth, and then eventually they'll calm down, but I can't focus on anything because of the twitching back and forth. So I deal with that, and it is nauseating at times, most of the time, excuse me. And so I struggle with that, and there are a few other things. I remember when I first went to vision therapy, the young Natalia, the young vision therapist, was brilliant. And as I was first speaking to her at that first appointment, she had asked, do I feel it when this eye twitches inward? And I said, what? I don't know what you're talking about. I'd never been told that. I didn't know it did that. And she said, yeah, I've seen it several times. It kind of rotates in and twitches and comes back, but it's so fleeting. It's like a little flicker, I guess. And I had no idea. So I don't know what that means. I think there's a nerve involvement. The other thing with my vision that I have, and I noticed this that first summer of 2022, and I brought it up to my own personal eye doctor, and of course he's not the workers' comp doctor, but he did. I think he kind of brushed it off, or he said it would go away or something. It was so long ago I can't recall. But I have sixth cranial nerve palsy. So the sixth cranial nerve controls the abduction of each eye. So for me to look this way, the right eye is abducting, the left eye is adducting, adduction. And so when I look that way, the left eye abducts, the right eye adducts. And so I have trouble, my eyes don't abduct out to the side. Like if you do a roadside sobriety test, I don't drink, but I wouldn't pass any tests, I'm sure. But and they say, look at my finger, and they move it back and forth. When they go out like this, my eyes only go to here. They don't go the full how they're supposed to go. So I have that issue, which makes it difficult when you're driving because you want to be able to like move your eyes and dart, look that way, and they just don't function right. So I have to turn my head to look. You should be able to see clearly if you move your eyes over there, but they won't go. They just stop right here. And so I have that issue, and I don't like that, but I also have an issue when I look up and down. In the extreme, it's very tight around my eyes. So the muscles are really, really tight. So I have trouble with that. So anyway, the vision issue, that's a huge thing too, because it keeps me from driving at night unless I'm just local and I have somewhere quick to go, like across the road, or the store is right down the road. So I don't drive on the interstate anymore because I'm afraid to. I'm afraid if I lose my vision and I'm going at a high rate of speed, that's not a good combination. So I don't want to chance it. And so I have this fear of losing my vision again. Even when I have to drive to doctor appointments, I take a 2-lane highway. I go to 2 different cities, one for neuro, one for vision. And I take a 2-lane highway either way. I don't do interstate. And so, it still worries me because I'm out on a 2-lane, and around here in the South, there's a lot of curves and hills and hollows. And so I I try to keep it on the 2-lane. I have to go. I have to go to the appointments. So it's nothing that I can get out of. And I don't have a driver to hire, and friends aren't available to take me on a whim or when I have an appointment. So I do it, I come back, and then, I try not to go far. So that's number one. And again, these aren't in any particular order. Number two is headaches. And right now my back is killing me because I'm not in a supported chair. So I have headaches and they've eased up for the most part. However, when I fell and hit my head, the body mechanics, it caused damage to my neck muscle here. So today I'm having trouble with it. I frequently do several times a week. And when I have trouble with this, it creates where it attaches back at the mastoid bone. I get ear pain completely surrounding my ear and deep inside. It's nerve pain. And that's been going on since the first, shortly after I fell. And I would complain almost like a hot poker stuck in deep into my ear. It's not that bad now, but the pain that radiates out whenever I have the neck pain, along with that is a headache. It's this entire right side. Goes down my shoulder, aches in my shoulder, aches, my arm is weak. So I deal with that, and this kind of headache with regard to this half and everything related to the damage, I'll wake up with it. It will not go away no matter what I take, and I'll go to bed with it, and then I wake up the next morning and it's gone. So it's a full day episode. Very rarely does it last beyond when I go to bed. So I'll wake up with it, I'll have it all day, I'll go to bed with it. It doesn't matter. I can take Tylenol, I can take, Tramadol, I can take Toradol, nothing knocks it. I use a good bit of Bengay because to me, I feel that sensation of the Bengay, that cooling, kind of burning, cooling effect. And that takes away the pain for just a little bit until it wears off, until the Bengay wears off. So I'm the old person using the Bengay. And it works. It does help. So anyway, the headaches, they're a booger when they happen, a few times a week, sometimes less, sometimes more. There's no rhyme or reason. But along with the headaches are the ear pain. So it's like a package deal. So I get a 3-for or a 4-for, 4-for-1. So another issue that I have is vertigo. Now, I used to have it really, really bad. And initially it was so bad that, I couldn't even walk. It was so bad. So now it comes and goes. So I have a minor amount constantly. It's not something that really affects me, but I do notice it, but then it flares up. So recently, over the last maybe 3 weeks, I guess, I've had it increasing a little more, not severe at all. It's mild, but it's enough to notice, like if I lean down to get something, I'll get it. If I'm at the chiropractor and I lay on my stomach and then I turn over, I'm always telling him, okay, hang on, because don't let me fall off the table because I've got some vertigo. So along with that vertigo, I guess it's not the same thing, but I have a loss of balance, and that's been going on ever since. I remember when I went to physical therapy or vestibular therapy for balance issues, I was asked to close my eyes and walk a straight line, and the therapist was right next to me, not going to let me fall. And I ended up going about 4 feet to the left, thinking I was going straight. I wasn't. So it was really off. It's better now, but it's still, I can turn around and then wobble. Usually it's more of a wobble to the left. I don't know why. I hit the left parietal lobe, so you would think the right side would be affected because it's the opposite, but it is the left side. That's the side I lean to or wobble to or seem to lose my balance and go that way a little bit. Sometimes it's very subtle, sometimes it's noticeable. So I have to always be aware of it because, if I'm not paying attention, I could keep on going and I don't want to end up on the floor again. So speaking of ending up on the floor again, along with these symptoms is PTSD. So I've been diagnosed with that. That is one of the diagnoses that the neurologist and the psychiatrist gave me. So one example of that, well, when I first was injured, and then when I was able to get out and about and, go get some groceries or whatever, I was constantly looking down because I slipped on a wet floor at a facility where I worked. And I didn't know it was wet. It was dry when I had just been in the room. And less than 5 minutes later, I'm back in the room laying on my back. So I had slipped on a wet floor, and I am constantly looking down. I did that. I'd go to the grocery store. I'm always looking for water because it's a big fear of mine. And so this morning we had such high humidity and fog, and it was so hot outside and muggy that all the windows fogged up, and my front porch, which is tile, started sweating. So when I had to leave and run some errands today, I went out the front door and I was like, I am so afraid to walk on that porch because all I could picture was me falling backwards and hitting my head again. So I very gingerly stepped like an elderly woman, and I was fine, but I still have that fear. I had it really intense initially. It's eased up some, but it makes me just, you just get a little panicky if you're walking on water or wet floor or, wet area. So there have been a couple times where I've almost lost my balance, or kind of lost my balance, but then recovered. And I tell you, the fear is terrible. There was a time shortly after, maybe a year or two after the brain injury. It's been 4 years and 3 months. So up to a couple years afterwards, my dog had been drinking water, and the bowl was near the entrance to the kitchen over to the side. So when she drinks her water, it's very messy, and I didn't realize there was water on the tile floor. So as I came around the corner from the kitchen, going and stepping that one step down into the dining room, I slipped and I grabbed hold of the door frame and I hung on for dear life. And when I finally could let go, I started sobbing. It was awful. I went to the kitchen counter, I laid my arms in my head, just laid down forward on the kitchen counter, and I sobbed probably a good 20, 30 minutes. It was awful. I was so fearful of that same thing happening. So that it's eased up a little bit now where it's not as traumatic if it almost happens, but it's still there. It's still very real. Another issue that plagues me every day, and I did a different video where I talked about this, is memory loss. I can't remember phone numbers. And as I said in that video, if I try to remember a series of numbers or letters or words, in my mind, I'm repeating them so I won't forget. And then when it comes time to write them down or to say them to somebody or whatever, if I have to give somebody a phone number and I have to go look it up, if I try to memorize it and tell them, I can't. I have to write it down. Just a few numbers. I have to write it down. So I have a hard time with that. And I have a hard time remembering just words that are in a sequence, and I'll say them in my mind over and over and over again to try to commit them to memory, and it just doesn't work. So there are other things related to my job that I have been forgetting, and I'm getting better, my brain is healing, but there is that issue. It is, sometimes I forget that I've met someone, and I meet them again, and I'll say, "Now, what's your name?" And they go, "Oh, I already met you. Your name is," they'll tell me my name, and it's like, "Oh, okay." I can't remember. So I deal with that. It's gotten better, but it still pops up every day. And then one of the big ones is fatigue. The fatigue is incredible. I mean, I don't get enough sleep because that's one of the other issues is I don't get enough sleep because I can't. My body won't now. But the fatigue is almost if I can, every day I need to have a nap, or at least shut my eyes and try to nap, maybe in the recliner. I don't usually lay down in the bed. And so I struggle with fatigue. I don't want to go anywhere. I don't want to do anything. I don't want to go to work. I don't want to do anything because I'm so stinking exhausted all the time. And I'm always telling my dog, Sophie, "Mommy's so tired." And she's probably like, "Girl, that's all you say. You're always tired." I am. I'm tired. I have no life. I rest. And I hate that because I want to be active. I can't. So I struggle with that. the loss of balance we talked about. Okay, one of the things I noticed, which is really weird, is decision making. After I fell, I had just, I was getting ready to start a business as an IV hydration clinic. So I had to put that on pause until I recovered enough to be able to do it. But I knew something was coming down the pike with regard to, I knew something was going to happen and I was going to get fired from my job because I was on light duty and, you know, they were treating me differently. So I thought I need to get in, I need to open my office, I need to get that going so that when something happens at work, at that job where I fell, then I'll have this backup. So I opened that business. I had a hard time with decision making. So I noticed it. Well, I noticed it prior to that. No, I noticed it probably about that same time. And it's been a constant. It's like, you know, I'll try to make a decision. What do I want to eat? I don't know. What do I want to, I want to go get groceries. What kind of menu do I want to make out? I don't know. I can't make a decision. And then when somebody says, hey, do you want to go out to eat? Do you want to, I'll, you know, meet you there. Where do you want to go? It's like, you pick. There are so many different things that I cannot make decisions on, or it takes me too long. You know, it's difficult. It's very difficult. So I don't like that. One of the things that I still struggle with a little bit now, I'm very self-conscious about it, and it's aphasia. I'm not able sometimes. I had a hard time initially, but sometimes I can't get the right words out. Or sometimes I will, I can't think of what I'm trying to say, or I'll be talking and then I stop because I don't know what I just said or where I'm going with it. In my mind, I'm trying to remember, like, okay, be sure to say this while someone's talking. And I'm trying to remember what I'm going to say. That is exhausting because I don't remember it most of the time. There are a few times now that I do. I can recover, but a lot of times I can't. And I've noticed that when I meet new people and I have to talk to them, make eye contact and talk, and I don't have any issue. I never had any issues with that prior to the brain injury. But now it's almost like I feel a little self-conscious and the words start to get a little more difficult. The conversation, me speaking, gets a little more difficult. It's easy here because I'm talking to a camera. But there are some times that I've struggled, you know, a little bit and I've caught myself. But it's really hard because when you're face to face with somebody and eye contact, that's intimate. And for some reason, that makes me stumble over some of the words, or I'll try to find the right word, or I'll say extra words I don't know how to explain it, but it's difficult. And I remember the summer after I fell and injured my brain, I was on light duty and I was in a nursing office and there were some CNAs in there as well. And they were talking and somebody looked at me and said something and I don't have a clue what she said. And I just looked at her. I didn't want to act, you know, like I didn't know what was going on, but I just kind of looked at her and smiled. I had no idea. I could not comprehend what she said. She said a sentence and I couldn't process it. So I still, every now and then, have a hard time with that. I have a hard time with that when I'm watching TV. I have to turn the volume up really loud and repeat it, you know, go back and rewind it to hear what they say because I'm not picking it up. It's not that they're quiet, it's that I'm just not picking it up. And I have a really difficult time with that. So I don't want to be one of those people that's like, what'd you say? What'd you say? So anyway, that has gotten a lot better. I did go to speech therapy for a little while. And, you know, I do a lot of, regarding the memory, I set a lot of alarms in my phone to remind me of things that are important, because if I don't, it's gone, just like that. I have Post-it notes I put around. I put them either on the bathroom mirror or on my kitchen stove because I'm going to be in the kitchen. You know, I have meds that I take that are right near the stove. I'll put it on my coffee maker so that I'll see it, because I have forgotten to pay bills. In like probably that first couple of years after the head injury, I would forget due dates on bills. They'd be out right in front of me and it didn't faze me. So, I ended up paying late fees on utility bills because I would forget. So that's gotten a lot better, a whole lot better. But I have the use of notes and alarms and what have you. So the other thing I really struggle with, and I take medication for, is depression and anxiety. Never really had those issues before. And now it's like, they're here. So that's common with a brain injury. So I don't like that because sometimes it'll get the best of me and I'll go through a period where I'm just not feeling it. And but then I perk back up for a little bit. So I struggle with that. Personality changes. I never had a problem speaking with people or feeling like, I never really wanted to be away from people, but I have a difficult time with that now. I don't feel as cheerful as I used to be. And, I try to be friendly, but I almost feel like I'm faking it. I feel like I'm an imposter or something. Again, this other video that I did, I talked about feeling defective. So that, I think, plays a big part. That and the anxiety play a big part in that feeling, in the personality, because I'm constantly thinking that somebody's going to look at me and go, oh, she can't even talk right, or she can't walk right, or she can't whatever, and I don't want to be perceived as that kind of a person. It is what it is, but the pride gets to me every now and then. I want to be thought of as normal. I don't want to have these issues, but I do. So I have to deal with them the best way that I can. So the other thing that gets me still to this day is I have an inability to regulate my body temperature. So somewhere when my brain got jostled around, something was affected, and I can, for example, I can get ready, go somewhere, and I will break out in a profuse sweat. I have low blood sugar, but it's not low at that time. It's a different kind of hot. And literally I'm burning up. My hair gets wet around the edges. I'm dripping sweat. My armpits get sweaty. I mean, it's terrible. And I can't cool off. But then when I do cool off, especially if I'm at home, once I do cool off, might take about 30 or 45 minutes. So it's not like you can get in front of the fan and you're fine. And, but I end up going the opposite direction, freezing cold. So I'll be super hot, tank top and shorts, sweating like crazy, cool off, heading the other direction. So it's a joke now to me. It's like, okay, let me get the blankets ready. Cause then I get my blankets, my throws that I have a couple of throws where my chair, recliners are in the living room. And I'm bundled up when I was just profusely sweating a little while ago. So the other day when I went to work, I work a PRN nursing job and I work 4 hours a day, a couple days a week. And so when I went into work, it was humid outside, but I walk slow anyway because of my back, because it jars my back when I walk. So, and it hurts. So I get in, I'm moving slow, so I'm not going to sweat. I'm hoping I'm not going to sweat. And I have to run down the hall at work or go down the hall to the registration office to pick up some paperwork every morning that I go in, and I'll just start sweating. And I sit down at the desk, and when patients come in and I greet them, the other day, this has happened maybe 3 times already, but this day it was public facing. The other time it was when I was back in the hyperbaric chamber suite talking to a patient, and I'm just dripping sweat. But it was one-on-one. This is where patients come to the window, I check them in, and then they go sit down. But you converse with them, and you got the next one, and the next one, and the next one. And the other nurses that are coming in, talking to me or getting paperwork for patients. And I'm sitting there, and I could feel it coming. I'm sweating, and then I'm dripping. It's like trickling down my face while I'm speaking to patients. And I was humiliated. And they just look at me, and I would say, I'm fine, I'll be fine in a minute. I didn't explain anything, but the next day I carried paper towels in my bag so I could have something right there and I could just kind of blot my sweat. It's terrible, and it'll go on for the longest time. So I think I'm gonna get a little portable small fan to put on the desk so that when I'm working, I can have the fan to be able to, cool off a little bit if it happens again. So that was one day that was just torture last week, and it was terrible. So I do have that issue. Workers' comp doctors they brush it off. I mentioned it to my PCP, and he recommended going to a special clinic for dysautonomia. So the autonomic nervous system is not functioning properly. But workers' comp, nah, you're fine. So if I had to go on my own, I would have to pay for it. It's just a work-related injury. I don't want to have to pay for it because I don't have the funds to, testing and what have you for that would be very expensive. And I don't know if my insurance would cover it because it's a work injury. So they may deny it. So that's another thing. That's probably the worst because it's very visible to everybody and it's embarrassing. So I have a sleep disorder as well now. It's hard to fall asleep. It's hard to stay asleep. It's hard to go back to sleep if I get up to let my dog out or go to the bathroom or whatever. I can't get back to sleep. Sometimes I can, but I might average 5 or 6 hours of sleep. This morning, I think I had 5.5 hours of sleep. And I was so tired. One morning I woke up at 3 a.m. and I could not go back to sleep. I laid in bed for about an hour, almost an hour. And I thought I've got to get up because, my back was hurting and I couldn't sleep. So got up, but I was so exhausted during the day. On top of all the normal fatigue I have from the brain injury. So one more thing that I wanted to include is loss of focus. It's hard for me to focus because I'll get busy on something and I'll start another task and then I'll start another task and I haven't completed these others that I initially started. So it's almost like an ADHD, but it's not. It is simply from the brain injury and I'm just not able to do what I used to do. On that note, something that's related to that is multitasking. I struggle. I used to be like the queen of multitasking. And as I've said in one or two other videos in the way back past, I used to be in charge of a unit at the nursing home. I was the nurse on this one particular unit. So I had 30 patients. I hated that, but I could focus on all of them and know everything about all of them because I'd see them day after day after day. And I can barely do two things at once, like the tasks. I do one and I forget about it and I go to the next one and then I might come back and go, oh, I got to do that, but I'll find something else to do. So I can't multitask like I used to. I have a difficult time, and that proved to be true when I started this new PRN nursing job. There were several things I had to do, and when I worked in the hyperbaric chamber suite, it was a little more manageable because I only had one patient at a time, and I could do everything in an order. I had it written down, so the steps were in an order. And now that we don't have any of those patients and I'm working at the front desk, I have to answer the phones. I have to take referrals over the phone while I'm greeting the patient that's coming in, while I'm scheduling them or registering them, or, there's a host of things. Another line is ringing and I have to do all these things at once. And that was difficult. I still don't have it down pat, but it's a little bit better. But my biggest fear was starting a new job and having a difficult time and maybe getting fired. So I don't think I'm going to get fired. I'm hoping not, but because I think they say I'm doing a good job, but it is difficult for me. It's not I can't just smoothly multitask. And there are some things I forget, obviously because of the memory, but I'm working on it. So I just wanted to give some insight on this brain injury and what it's like living with a TBI, because these are things people don't see for the most part, except the sweating. Let's see, what else? I guess that's really the one that would be most visible. But these are things people don't see, so they don't know. When you have a brain injury, you want to know how life is going to be. You know, it's like I'm researching, trying to see, is this normal? How long is this going to last? What are the long-term effects of the brain injury? And I know there are people out there like this that want to know, that want to, have questions. And I had to watch a lot of YouTube videos on brain injury and listen to people that have had brain injuries to find out really kind of what to expect. And everybody's different, but these are some of the ones I mentioned is 14 or 15 of the issues that I have. And that's not a complete list, but I had to learn all this stuff. Everybody's different. Some people may have 5 or 6 of those symptoms. Some people may have a bunch of other symptoms, but a lot of these cross over. So most people experience most of these. And it's very frustrating. People look at you like, well, you're fine. I've been told at the job where I fell and had the injury, I've been told by people there, it's like, you just bumped your head. No, I slipped on a wet floor, went back, broke my back, and then had the hit up here and had the head injury. So it's not just a simple, I bumped my head and I'm fine. It is something that, it's just difficult. It's very difficult because it was a hard hit and there was so many symptoms that came as a result of it. So I struggle daily, and when I don't post a lot of videos, I'm usually struggling with some symptoms or something. And anyway, these are maybe an eye-opener for you. If you know somebody with a brain injury, just know we feel like we suffer in silence because people don't understand. They don't understand the fatigue. My family doesn't understand why I don't drive out of state to see them, because I can't. If I lose my vision, plus my back, the vibration of traveling in a car, my spine vibrates and it's very uncomfortable. It causes pain. Eventually, when I do it long enough, an hour, if I drive into Nashville for a doctor appointment, my back hurts by the time I'm there because of the vibration on the road, potholes, what have you, speed bumps, whatever. And so people struggle with these things and most people don't know. So because of that, it can cause anxiety and depression because you don't want to get out somewhere and then have an issue. And then the depression because you can't get out now and live your normal life. I can't go to the gym right now, especially just because I hurt too much. I was going, I canceled it. I went back, I had difficulty, I canceled it. So I have done that, but I've struggled with it. I can't get out and race walk like I used to. I don't drive at night generally. Most of the time I don't. There might be that one rare occasion, picking up a prescription that might be ready in the evening. So there is anxiety and depression as a result of all of these issues. Nobody understands. You feel like that anyway. And so they just see this normal looking person. And we're not normal. We have issues going on inside that create more issues. So if you know anyone with a TBI, I'm thankful mine wasn't debilitating and, caused me to be paralyzed. But if you know someone with a TBI, just talk to them and see how they're doing, because it's tough. It's really tough. So anyway, I will see you on the next video. Thank you so much for popping in, and be sure to like, share, and subscribe, and I'll talk to you soon.